What if I told you there's a shot that could make you feel full without eating, shed pounds while you sleep? For millions of Americans, especially those in their 50s and 60s, this miracle drug is becoming their reality. Welcome to the Ozempic revolution, where a diabetes medication is reshaping bodies and a national debate. They've been called Hollywood's worst-kept secret, weight loss in a needle, and the easy way out. But what exactly are these GLP-1 drugs? And why are they suddenly everywhere? In 2023, prescriptions for medications like Ozempic, Wegovy, and Mounjaro skyrocketed by 300%, with the highest adoption among Americans aged 55 to 65. But while celebrities and CEOs rave about their transformations, millions of others are left wondering, are these drugs the answer to America's obesity epidemic, or are we looking for a quick fix to a much deeper problem? Let's cut through the hype and examine what's really happening with our bodies, our healthcare system, and our cultural attitudes toward weight. GLP-1 stands for glucagon-like peptide 1, which is actually a hormone your body produces naturally after you eat. Consider it your body's built-in satisfaction signal, letting your brain know, we're good on food for now, while also slowing down the rate at which your stomach empties. But for people with certain conditions, this system doesn't work efficiently. That's where GLP-1 receptor agonists come in. They're medications that mimic this natural hormone, but with superpowered effects. Originally developed for type 2 diabetes, drugs like semaglutide, sold as Ozempic and Wegovy, and tirzepatide, sold as Mounjaro, work by slowing down digestion so you feel fuller longer, reducing appetite signals in your brain, stabilizing blood sugar levels, and yes, promoting significant weight loss, often 15 to 20% of body weight over a year. That last benefit caught everyone's attention. Suddenly, a diabetes medication was being hailed as the most effective weight loss treatment in medical history. And the results can be dramatic. As one patient put it, "For the first time in my life, I forgot to eat lunch. I actually forgot about food." Now, for someone who's struggled with weight their entire life, that's not just a medication effect. That's freedom. While these drugs have been around since 2017, their use exploded in 2023. Interestingly, the biggest adopters haven't been young influencers, but Americans aged 55 to 65. There's a good reason for this demographic surge. This generation faces both rising obesity rates and the onset of weight-related health conditions like heart disease and diabetes. But there's a catch, and it's a big one. A monthly supply costs around $1,000 to $1,300 without insurance. And while coverage is improving for those with diabetes or documented obesity complications, many insurance plans still classify these drugs as cosmetic treatments when used primarily for weight loss. This has created a healthcare divide. Those who can afford to pay out of pocket are accessing these drugs, while many others are left with familiar advice to eat less and move more, advice that science increasingly shows is insufficient for many people battling obesity. Another thing most promoters don't mention, these aren't one-and-done treatments. Most people need to stay on them indefinitely to maintain results. Stop the medication and most patients regain much of the weight they lost. To understand why these drugs are so revolutionary, we need to understand what science has learned about obesity in recent decades. Here's what many people don't realize. Your body actively fights against weight loss. When you lose weight through diet and exercise alone, your body perceives this as a threat to survival. It responds by increasing hunger hormones, slowing metabolism, conserving energy, creating powerful cravings. It's not a character flaw or lack of willpower, it's biology. Your body has a set point weight that it defends fiercely. You might win the battle for a few months with discipline and restriction, but your body's playing the long game. This is why approximately 95% of traditional diets fail long-term. It's like trying to hold a beach ball underwater. You can do it temporarily with enough effort, but eventually exhaustion sets in and it pops back up. What makes GLP-1 drugs different is they actually change this underlying biology. They work directly on appetite centers in your brain, essentially resetting that defended weight set point. For many patients, this creates an unprecedented biological opportunity for sustainable weight management. These drugs haven't just changed bodies, They've ignited a cultural firestorm. The debate touches on deeply personal issues: body image, personal responsibility, medical ethics, and economic inequality. On one side are those who see GLP-1s as the medical breakthrough we've been waiting for. If we treat other chronic conditions like heart disease and depression with medication, why not obesity? After all, we don't expect someone with high blood pressure to just try harder to lower their numbers. On the other side are concerns about medicalizing weight and body size. Critics point out that these drugs risk reinforcing unrealistic beauty standards and might further stigmatize those whose bodies don't conform to society's ideals. And then there's the question of who decides what overweight even means. The BMI chart that classifies some 70% of Americans as overweight or obese was created in the 1830s by a Belgian mathematician with no medical training. Many health experts now consider it an outdated and often misleading tool. The debate also touches on whether medication should be our first response to a health issue that has complex social and environmental causes. Our food system, work schedules, stress levels, and community design all contribute to obesity rates. As one critic noted, we're developing $1,000 a month drugs to solve problems created by $1 fast food meals. Like any medication, GLP-1 drugs come with potential downsides. Common side effects include nausea, vomiting, and digestive issues, especially when first starting treatment. There's also a phenomenon doctors call Ozempic face, a sometimes gaunt or aged appearance that can result from rapid weight loss. More concerning are the long-term unknowns. These medications have only been widely used for weight management for a few years. Questions remain about long-term cardiovascular effects, impact on muscle mass versus fat loss, potential effects on the pancreas, psychological dependence, and whether benefits persist over decades. For the 55-65 age group that's increasingly using these drugs, these questions are particularly relevant. They'll likely be taking these medications into their 70s and beyond, potentially for decades. So where do we go from here? The GLP-1 revolution is just beginning. Pharmaceutical companies are racing to develop oral versions that don't require injection, more affordable options, combination therapies for even greater effects, and targeted formulations for specific health conditions. Meanwhile, health systems are grappling with coverage questions. Some employers and Medicare plans are expanding access, recognizing that while these drugs are expensive, they may reduce long-term healthcare costs associated with obesity-related conditions. For individuals, the decision remains deeply personal. There's no one-size-fits-all answer. Many health experts now advocate for a middle ground, using medications as tools alongside sustainable lifestyle changes, not as replacements for them. The story of GLP-1 drugs is still being written, but one thing is clear: they've forever changed how we think about weight, health, and the relationship between medical intervention and personal choice. Whether these drugs represent a miracle solution or a concerning trend depends largely on your perspective. What's undeniable is that they've forced us to confront uncomfortable questions about why we value certain body types, who deserves access to medical innovations, and what health really means in a society obsessed with appearance. As we navigate this new frontier, perhaps the most important question isn't whether these drugs are good or bad, but rather how we can ensure they're used thoughtfully, equitably, and in service of genuine health rather than arbitrary beauty standards. After all, true well-being isn't measured on a scale. It's measured in the quality of our lives, the health of our relationships, and our ability to participate fully in the world around us. What do you think about the GLP-1 revolution? Share your thoughts in the comments below. If you found this video helpful or even just a little bit entertaining, go ahead and hit that like button and subscribe for more health-related content. Stay safe, stay curious, and I'll catch you in the next video. Thanks for watching.